My name is Tina. Welcome to this teaching presentation on common conditions affecting our joints. Today we'll be exploring the key differences in treatment approaches for rheumatoid arthritis, RA, and osteoarthritis, OA. I will walk you through the similarities and differences between these two conditions, what they are, what symptoms to look for, and how they're treated. I'll also share strategies to reduce discomfort and manage them from day to day. To understand RA and OA, we first need a quick refresher on the musculoskeletal system. This system gives our body structure and support and helps us move. First, bones provide the framework and protect vital organs. Next, muscles move bones and help support posture, balance, and joint stability. And at places where bones meet, our joints, cartilage acts like a smooth cushion so the bones glide instead of grind. Many joints also have a thin lining and joint fluid that work like lubrication. When any part of the system becomes irritated or starts to wear down, you can feel pain, stiffness, swelling, and a decreased range of motion. And because all of these structures work together, even small changes in one area can affect the whole joint. When stability, cushioning, or lubrication are disrupted, the body often compensates in ways that increase strain over time. That's why early recognition and support of joint health are so important. Okay, now let's define our terms. Rheumatoid arthritis, RA, is when the immune system mistakenly attacks the joint lining. That attack causes inflammation and swelling that can continue even when you're not using the joint. Over time, that ongoing swelling can damage the joint itself, and many people notice stiffness that's worse in the morning. Because it's a whole body inflammation condition, it can also affect more than just the joints. Some people notice things like fatigue, dry eyes, low-grade fevers, or just feeling run down because the inflammation is systemic. Now looking at osteoarthritis, OA, this is more of a wear and tear process over time. The cartilage cushion that helps the joint glide smoothly starts to break down. When that cushion is thinner, the joint doesn't move so comfortably, so pain is often worse with movement or activity. And because of this mechanical wear and tear over time, the joint may start to feel better with gentle movement and worse after heavier activity or longer periods on your feet. Epidemiology tells us who is affected. RA is less common, but about 0.6 to 1% of U.S. adults, or around 1.3 million, are affected, and it affects women more often than men. Worldwide, about 18 million people were living with rheumatoid arthritis in 2019. OA is much more common. In the U.S., about 33 million adults have OA, and worldwide it affects 528 million people. Most people with OA are over the age of 55. These patterns help explain why OA is often seen later in life, while RA can show up earlier and tends to involve more inflammation. Additionally, it is important to remember the arthritis burden of any kind tends to be higher when people face barriers like cost, transportation, physically demanding work, or limited access to specialty care and physical therapy. These disparities lead to delayed care, activity decline, and worsening prognosis related to ineffective pain management. This is why improving access and support systems matters just as much as knowing the statistics. When we talk about symptoms, OA and RA can both cause joint pain and stiffness, but they tend to show up differently. With OA, symptoms often start in one joint or one side at first, and the pain is usually worse with activity and better with rest. With OA, stiffness is common after sitting or first getting up, but it usually loosens up sooner, often within 30 minutes. OA commonly affects weight-bearing joints like the knees and hips, and it can also involve the spine and certain finger joints. With RA, symptoms often affect both sides of the body, like both hands or both wrists, and joints may look swollen and feel warm and tender. Morning stiffness tends to last longer, and some people also feel fatigue or just generally run down. Either diagnosis requires your history and a joint exam. Your provider is looking at which joints are involved, how long stiffness lasts, and whether there is swelling or warmth. For osteoarthritis, x-rays can be helpful. Over time, they may show joint space narrowing, suggesting cartilage loss and possible bone spurs. Lab tests, though usually normal with OA, can help support the diagnosis of RA. Blood work looks for elevated inflammation markers, C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR. Other tests include rheumatoid factor RF and anti-cyclic citrullinated peptide antibody, anti-CCP. Imaging can show swelling and joint damage over time. Treatment looks different because the causes are different. For OA, the goals of therapy are to reduce pain and protect joints. We're mainly managing symptoms. That includes staying active, strengthening the muscles around the joint, weight management if needed, and using heat or ice to ease stiffness or swelling. Pain relief may include topical or oral anti-inflammatory medicines when it's safe. In more severe cases, injections or joint replacement may be considered. In RA, the goals of therapy are to control inflammation early and prevent joint damage. This usually means medicines that calm the immune system, such as disease-modifying anti-rheumatic drugs or DMARDs, and sometimes biological or targeted therapies. During symptom exacerbation or flare-ups, short-term anti-inflammatory support may also be used to help control pain. Physical therapy still matters for both, but RA treatment focuses on slowing the disease process, not just treating pain. Because these medications can affect the body in other ways, regular monitoring and follow-up care are an important part of treatment. Beyond medical treatment, compassion is vital. Living with chronic joint pain affects not just the patient, but also families and caregivers. So providers must build relationships rooted in empathy, recognizing both the physical and emotional toll these conditions can take. Listening to a patient's lived experiences and validating their daily challenges helps build trust. Empowering patients through shared decision-making and encouraging questions can reduce anxiety and improve confidence. It also helps patients feel more in control of their symptoms and their plan. Including family and caregivers when the patient wants that creates better support at home and helps everyone stay on the same page. When care feels respectful, collaborative, and compassionate, patients are more likely to follow through and feel supported long term. Effective arthritis care requires collaboration. Management often involves a team that includes primary care providers, specialists such as rheumatologists, and rehabilitation professionals. Coordinating medications, monitoring lab work, and adjusting treatment plans depends on clear communication among providers. Physical and occupational therapy supports function and independence. Most importantly, patients are active members of their care team, participating in decisions and long-term management strategies. Collaboration isn't limited to the healthcare setting. Care works best when the whole team stays aligned, including pharmacists, nurses, and family or caregivers when the patient wants that support. When everyone is sharing the same goals and the same plan, it reduces confusion, improves follow-through, and helps patients catch problems early, like medication side effects, flare-ups, or setbacks in function before they become bigger issues. In summary, both OA and RA can disrupt normal joint structure and function, affecting mobility and overall quality of life. While OA is primarily degenerative and RA is autoimmune and inflammatory, both involve physiological changes that can worsen over time without appropriate treatment. Early evaluation helps reduce the risk of long-term joint damage. Movement, strengthening, and therapy support joint stability and function in both conditions. Although treatment approaches differ, preserving mobility and independence remains the shared goal. Patients play an active role in managing their condition, and collaborative, compassionate care helps support long-term outcomes. Remember, the goal isn't perfection, it's progress. Small, consistent steps with the right support can help you protect your joints and stay independent. Thank you. This final slide contains the references used to build this educational presentation.